Hello, thank you all for joining us today. I am Susannah Schaefer, President and CEO of Smile Train, the world's largest cleft lip and palate organization. And I'm so excited to be here today with Dr. Atul Gawande. Many of you are already familiar with Dr. Gawande as a surgeon, a public health researcher, a talented author, the founder of Lifebox and Ariadne Labs, and member of the Biden-Harris Transition COVID-19 Advisory Board. And now we're so excited to add yet another title as we launch the Smile Train Lifebox Safe Surgery and Anesthesia Initiative. Dr. Gawande, we are so thrilled to have you serving as the global ambassador for the initiative.
Susie, thank you. This is such a pleasure to get to jointly announce this initiative of Smile Train and Lifebox coming together. This is not the first time we've come together. I'll get to tell the story a little bit more as we go, but 10 years ago when I was leading a World Health Organization task force that took on making surgery safer, we identified a checklist that could cut deaths in surgery by 50%. And part of deploying that ended up being a partnership with Smile Train, making it happen in your hospitals around the world that was pivotal to making a big difference in the safety of surgery globally. Susie, you have a history of working with marginalized and vulnerable populations, and your work at Smile Train is really a continuation of that. Can you tell us about that history of yours while also introducing us to Smile Train and its impact?
Yes, supporting vulnerable populations and in particular children is something I am very passionate about. I've been on the board of directors of Smile Train for 17 years, and it has been my privilege to serve as the president and CEO for more than 7 years now. We also serve a very marginalized population, people with cleft lip and palate. Most of our patients are children. Every day, 540 babies are born with a cleft. Many people, especially in the US, look at cleft as a cosmetic condition, but the truth is, without surgical treatment, it can be life-threatening. And that's why our model sits so well with Lifebox. Atul, why don't you tell us more about Lifebox and the work it does?
Awesome. Thank you, Susie. Lifebox was started 10 years ago, and it got started after work that I got to be part of with the World Health Organization, defining some standards of surgical care, including a kind of simple team checklist that could dramatically reduce the occurrence of major complications and deaths, whether it's in the highest income parts of the world or the lowest income parts of the world. And then it really spread rapidly into practice in the high income parts of the world, becoming a kind of standard of care. 90% of the operating rooms in the high income world now use a team checklist that's been shown to cut deaths, including in Scotland, for example, sustained 36% reduction in deaths for the last 6 years. We've seen similar demonstrations across the United States and in other parts of the world. Now, it has only reached 60% of the operating rooms in the middle income part of the world and only 30% of the low income parts of the world. The checklist, it's about 19 items that are like a 2-minute check, but they cover, the key things like making sure an antibiotic is given at the right time, making sure that people really understand what the medical issues of the patient are, and everybody are on the same page about planning. But there's one item that is a technology that is a simple safety monitor for operating rooms, a pulse oximeter, which measures the oxygen level in your blood. It's a little finger probe that many people will be familiar with. I know you are, Susie, because what we set out to do together in 2011 was we drove the price of that down for the middle and low income world because it had become unaffordable. And Smile Train was an important component of that, because what I asked Smile Train to do was guarantee that for your hospitals, you would buy enough of those oximeters if manufacturers could get the price down. You guaranteed that enough would be bought for at least 2,000 oximeters for your 1,000+ network of hospitals. The result was we could go to the manufacturers and say, over the next period of time, we're going to purchase 10,000 of these. And they'd lowered the price of operating room grade oxygen monitoring from over $2,000 to $250 delivered to the door. And then Lifebox was formed not only to bring low-cost technologies like that pulse oximeter to bear, but then training and simple systems of care like that checklist to make it so we could have safer surgery and anesthesia globally. Smile Train, bringing it to those 1,100 hospitals that you have relationships with, really demonstrated that this could be done in the lower income parts of the world, can be delivered, and we have now moved that those oximeters into 25,000 operating rooms around the world, trained 10,000 anesthesia providers with our little team at Lifebox, and an enormous network of partners like the World Federation of Societies of Anesthesia, who have connected us to people willing to do training all over the world. And now we get to come back together to talk about the next stage in improving the safety of surgery globally.
Yeah.
So Susie, I wonder if you could tell us about our more recent work that has started back together under COVID.
Well, COVID has made our monitoring tools, like the pulse oximeters, even more essential. We have distributed an additional 500 oximeters throughout our partner network to support surgical teams on the front lines. We were also pleased to support the development of the COVID-19 surgical patient checklist, a tool you've walked us through the incredible impact of the WHO's surgical safety checklist, and it is a cornerstone of our safety and quality protocol. The COVID surgical patient checklist is an addendum that could not be more necessary. Resuming surgical care during COVID comes with new challenges for surgical teams, especially for the anesthesiologists who are at increased risk just because of the nature of their work with patients. As our partners resume surgery around the globe, it is essential that they are safe and that the children and families who so urgently need surgical care remain safe. The COVID-19 surgical safety checklist gives best practice guidelines that can be adapted to suit the regional context of where our partners work, and it is an incredibly invaluable resource. So we have a long history of working together to raise the standard of safe surgery and anesthesia, and this leads us into the exciting initiative we are launching today. Atul, will you do me the pleasure of saying what our two organizations are partnering on?
Well, this is so exciting for us. It's a 3-year deep partnership between our two organizations to elevate the standard of pediatric surgical and anesthesia care across lower and middle income countries around the world. Of course, focused on cleft where Smile Train is focused, but really having a chance to have impact going well beyond. We're doing this in a very particular way, and that's through scalable innovations and capacity building that enables better systems of care as well as better trained teams. And I wonder if you could discuss a little bit the vision of Charles Wang and how it connects up in some ways with this initiative we have planned.
I would love to. Charles Wang, the founder of Smile Train, left us with quite a legacy. He, of course, defined our model of local partnership and empowerment because he saw that mission-based models disempowered local providers, in many cases, further marginalized the most vulnerable children. He was passionate about technology and the potential of technology to revolutionize education, training, and surgical tools that would have a high impact on surgical safety. Technology is in our DNA. We have Smile Train Express, the largest electronic cleft treatment patient database in the world, which gives us incredibly valuable data for research. We have the virtual surgery simulator, which offers digital simulation training on cleft surgical procedures. We have developed apps for speech services, and we recently took on operations of Simulair, which manufactures the world's leading cleft lip and palate simulation devices for education and training. This partnership, with its focus on capacity building, research, and innovation, really marries everything that Smile Train believes in and works towards. Safety is our first priority, and this partnership will strengthen and help us scale essential tools and training. It will help us identify gaps in care and develop innovative solutions. For example, we know that in low resource settings, 48% of surgeons in low and middle income countries experience frequent power outages. They need headlights that run on battery power, can last as long as even the most intensive surgery, and are as bright as the headlights you would see in an OR in the United States. We also need these headlights to be specialized for the unique demands of cleft surgery. So we'll join our expertise in cleft with Lifebox's expertise in developing innovations for resource-limited environments to address this very need. We know that this partnership will inspire a number of fit-for-purpose innovations that will help our partners immensely. Truly, I am so excited to begin this work. Atul, I would love to know what part of this initiative you are most excited about.
Okay, that's interesting. I would say it's a couple of things. One is the speed with which we can solve problems. I was really struck during this COVID pandemic how quickly we're able to move together to establish, as you mentioned, that COVID checklist that modified the protocols for surgical care to include those critical steps to keep the team and the patient safe around the coronavirus. And the way we were able to start distributing pulse oximeters very quickly in large numbers to help not only in the operating room, but then in the hospitals where you were working more generally, so that people who had pneumonia didn't necessarily have readily available COVID testing, you could monitor their oxygen requirements and get the right care for them. As we look forward, I think that same speed will happen as we apply it to the areas you just talked about, and then further ones that we identify around achieving safer anesthesia, fewer infections, and overall better teamwork with better outcomes. I think one of the clear indications of how closely this is going to work is that we have asked that you join our board as well. And we're really grateful that you would join our board. And that is going to just lead to this even deeper integration between our focus on safety globally for every operating room in the world, and your focus on being a pioneering organization built around cleft. And I think there's just amazing opportunity that comes out of that.
Yeah, I'm so grateful for that opportunity and to be working closer with you and with the Lifebox team in that capacity as a board member. So thank you for that.
Thank you. We talked a little bit about the COVID-19 effect on both of our organizations and what we set out to do. Can you talk a little bit about how the coronavirus pandemic has affected Smile Train's work?
Sure. Well, like many organizations, COVID-19 had and continues to have a huge impact on our programs. Because cleft surgery is considered an elective procedure, and to ensure the safety of our partners and patients, many of our partners had to postpone surgeries and in-person care in the spring and summer. I think when you hear the term elective surgery, you think non-necessary, but know that this is not true for cleft lip and palate surgery, and especially in low and middle income countries. Malnutrition is a concurrent illness, and neglect of it is due to stigma many times. All of these things can be life-threatening for babies with clefts. Postponing in-person care, however, did not stop us or our partners from stepping up to support patients. Since January, Smile Train has provided more than $1 million in the distribution of PPE, personal protective equipment, hand washing facilities, and masks for partners and patients affected by COVID-19 across the globe. In addition to distributing food, hand sanitizers, and PPE within their communities, our medical partners have been spending time teaching communities the importance of hand washing and social distancing. In addition, many of our providers are using virtual telecare to remain in touch with their patients, helping to care for them even while remaining socially distant. Through telemedicine, life-saving care, such as breastfeeding, guidance for mothers of babies born with clefts, has been able to continue. Smile Train's medical partners have remotely treated thousands of cleft patients, providing vital guidance to families, assisting new patients awaiting surgery, and identifying and helping those in need of food and supplies. Now we're seeing our partners resuming surgical care again, and we're working to ensure that they can do so safely. In Africa, partners are operating at almost our pre-COVID volume. Smile Train is supporting our local partners with grants that will aid in testing of patients before they undergo surgery. We're increasing our investment in surgeries to account for new safety protocols. We're increasing our investment in hospital cleaning staff and wash services. We're continuing our investment in PPE and, of course, devices like pulse oximeters. Atul, perhaps before we close, you could talk to us a little more on the wider landscape of global surgery under COVID.
Well, I think we've seen it through each of our lenses, but it's a similar picture. Each part of the world has had a very different experience. In Latin America, cases have exploded, and there's not been great controls. We, on the other hand, have seen places like Vietnam and Thailand, where you're working, and see that they've done a remarkable job of deploying testing and getting it, frankly, under better control than we've had in the United States, and sustaining it through this entire period. And then everywhere in between, with Sub-Saharan Africa having a range of different experiences, in some places having remarkable testing, like in Uganda, and in India having a very large burst of cases, and now a decline that has occurred, even as in Europe and the United States, it's kind of, we're out of control. What that has taught us is that they've each needed a different plan, and we have, at Lifebox, have contributed to surgical guidelines that help everywhere understand when's the moment you need to do what you had to do at Smile Train and stop elective surgery.
Mm-hmm.
But then also, how do you safely turn it on? What are the systems you need in place? And I think those systems that you just described are exactly the level of consideration that reflects on what it takes to make surgery safer. You have to go down to the basics of, now, what parts of your infrastructure for keeping everything clean and sterilized are going to still be functioning? Do you have a staff to make sure that the cleaning operations and everything is able to happen? Are you able to get testing available, especially in areas where cases are at a very high level? And the further consideration that in many of the places we work is that the majority of surgery in some of these environments is always emergency. So you don't want to shut down surgical operations, or you suddenly can't do C-sections for emergency delivery of babies, right, and address trauma and other kinds of needs. So when I think about what we are coming together to work on, it's always the same basic things: workforce, training, systems, and then innovation around making the system even better with each passing year. I couldn't be more grateful for what the COVID pandemic, oddly enough, taught us about being able to work together. I think it was an important contributor to our coming to realize we have a partnership that we can pursue.
Very well said. Yeah, the silver linings in a global pandemic, right?
Absolutely. You got to look for those because
You have to.
you'll
You have
only
to.
cry otherwise.
Correct, correct. Well, thank you so much for joining me today. It has been a pleasure, and I look forward to seeing what Smile Train and Lifebox will achieve together.
Thank you to you personally. Thank you to your entire team. And thank you to your amazing medical advisory board and network of hospitals and surgeons and teams around the world. They've been an important means of driving another standard in surgical care, not just in humanitarian care and cleft, which is your focus, but actually it's had ripple effects throughout the system.
Thank you. We are so excited.